tonight, as COVID-19 cases rise in younger people, child care facilities across the region are now a week into a new mask mandate from the governor.
Some of the centers having to follow this say it's easier said than done. The governor issued the order last Wednesday requiring masks at state-regulated child care centers for all staff, visitors, and children ages 2 and up. As many parents already know, 2-year-old children aren't always the best at following directions, making the governor's order a tough one for many child care centers to follow. Tony Black is live in studio after speaking with some frustrated businesses. Tony?
Matt and Megan, a week into this new mandate, and child care centers I spoke with say this rule is very difficult and sometimes impossible to enforce. One say that they try to do it when the kids arrive, but then they give up not long after that.
We will try, but I can tell you right now it's failing miserably.
It's where kids come to learn and play. Here at K2 Daycare Center in Camillus, they're having a hard time enforcing the rules.
It's been pretty rough. The kids come in. We try to put masks on them, they take them off, and we will not fight with them.
A recent mandate from the governor requires kids 2 and older to mask up inside child care facilities. Owner Kelley Leahy says it's a game to the kids that they won't play.
They put each other's on, and we end up playing mask police the majority of the day.
You want to sing Wheels on the Bus?
A similar story at Shining Stars Daycare Center in East Syracuse. Co-owner Stella Penizotto says the kids are doing the best they can to keep them on, but it doesn't come without challenges.
It's just hard. The 2-year-olds don't understand. They sneeze in it, they lick it.
The Office of Children and Family Services says that since August 1st, the number of children testing positive for COVID from child care settings has quadrupled. For staff, tripled. But that's not something these 2 centers are seeing.
I'm not saying that it can't happen. I just think that our kids have suffered enough.
No cases so far this year with kids at the center in East Syracuse. In Camillus, a very low number.
Since we've had the Delta variant, I've had 1 child contract COVID. There was 0 spread in his classroom.
How many buttons are left?
Penizotto says the workers spend a lot of time on mask duty, another task in addition to learning and playing.
The bulk of their day lately has been, please keep your mask on. Let me help you put your mask back on.
The center in East Syracuse shared some parent perspective with me on this mandate. Many say they don't agree with it and have concerns about learning impacts on kids from not seeing those verbal cues from their teachers. One parent did say they are happy their child is wearing a mask to offer protection since he is unvaccinated.
The Syracuse Police Chief was before city lawmakers at City Hall today, answering questions on the police staffing levels and the issues at Henninger. Chief Kenton Buckner addressed a number of issues at the meeting, including a staffing shortage in the department that caused the department to cut back on some special units. And from a police perspective, he says there is no city school having more of a problem right now than Henninger. CBS 5's Vanessa Rizzitano was with the Live Eye in Syracuse tonight.
We've been following the chaos at Henninger High School since fights have been breaking out for the last 2 weeks since students returned back to the classroom. Parents left frustrated, wondering if they should even send their kids back to school. With fights breaking out, fire alarms being pulled, chaos in the hallways, and reports of potential guns on school grounds. Syracuse police are making efforts to get violence under control at Henninger High School, following repeated events since the school year started. Every school in the Syracuse City District only has 1 officer, but SPD believes Henninger needs 2 at all times.
And at no point this week or last or in the future will we let Henninger go below 2 officers. And if that means that I have to assign somebody from patrol to that Henninger school because somebody's sick or whatever, then that's what we have done and that's what we will do going forward.
Syracuse Police Chief Kenton Buckner making it clear to the City Council that he's willing to send even more officers if need be.
We're going to do everything that we need to do to ensure that students, faculty, and staff are safe.
Parents we spoke to last week are not pleased with the environment their students are in right now and told us they felt the district was not being honest about what was happening. With this, I asked Chief Buckner if he thinks the Syracuse City School District is doing enough.
But overall, I think the school system does a good job of holding themselves accountable, and I'm happy with the relationship that we have, and I think that they're doing a great job.
Even with officers on school grounds, police say there are very few situations that call for an officer to step in on a physical altercation.
The first people that are going to engage in fights are the sentries and the school staff. We will not engage in fights or disturbances until we are asked to by the school district. Now, obviously, if it's a dangerous situation, then our officers are going to jump in.
The school district's adding more sentries last week after these fights breaking out. The Syracuse Police Department saying today that they are on school grounds to step in if need be when it comes to a fight, and also just be there to build a relationship with the students.
For healthcare workers, the ones set to take effect on Monday.
People who will not get vaccinated are the only reason that this country and these communities and our cities have not been able to be fully engaged in a state of normalcy.
So the governor is not backing down, but she is hinting at a plan to deal with what some healthcare leaders predict will be a staffing crisis caused by the mandate. Good afternoon. I'm Doug Embledge.
And I'm Jenny Ryan. In Monroe County, about 22% of nursing home workers are unvaccinated. Many facilities are already limiting admissions. Jane Chaco is live in Rochester now. Jane, the governor saying today she has a plan, but is not sharing many details about how to deal with this looming crisis of staffing.
Yeah, Jenny, Doug, one thing that is not mentioned in the governor's plan is a testing option. She calls it unpractical, but she is looking for reinforcements to replace those who are choosing to quit rather than get the COVID vaccine shot. At Strong Memorial Hospital, workers are already strained.
We have been going full tilt for 18 months now, more than 18 months. And the honest truth is we are exhausted mentally, physically, emotionally.
When asked about the vaccine mandate, Governor Hochul stood firm on the decision that unvaccinated workers will be terminated on September 27th, the vaccine deadline.
To all the health care providers, the doctors and nurses in particular who are vaccinated, I say thank you because you are keeping true to your oaths. To those who won't, we will be replacing people.
But nursing homes are already seeing the impact. Kelley Leahy is in charge of patient and family care at Strong Memorial Hospital. She says 15 nursing homes they refer patients to have paused admissions.
We always have a number of patients who are awaiting that nursing home bed offer, and for a variety of reasons they may be delayed, but not to the degree that we're experiencing today.
Leahy says there are spots at some nursing homes, but finding long-term care beds are challenging.
It's creating a situation in which we have to be more expansive about our reach for those referrals across the Western region.
Hochul says a plan to support nursing homes is coming soon.
We are sending out a call statewide, and there are facilities, for example, in New York City, where they have 98% of their staff are vaccinated. They don't have a staffing shortage. We're working closely with various hospital systems to find out where we can getting other individuals to come in and supplement places like nursing homes.
And one idea the governor mentioned but did not get into specifics, calling on the State Department to acquire visas for foreign workers so they can bring more nurses to New York. And the governor did not mention how long that plan would take.